here today, and welcome. We're going to dive into the topic that stretches the bounds of imagination and challenges the foundations of social, ethical, and logical understanding for the future of our society and the members of it. Today we're going to be debating about future babies and them being grown in laboratories and the repercussions, ethical considerations, and the logical implications. This is not merely a hypothetical inquiry, rather a profound exploration into what could be a potential future. Now, we're going to embark on this journey of intellectual discovery, and as we navigate the nuances of this debate, I would like to keep in mind the importance of open-mindedness and respect of both sides of this debate. Okay, thank you very much, and let's begin. Each side may present. You can begin.
Well, we are in favor of this topic. And the first argument that we have is that we think that in the social well, first I would like to socio-economical, in the socio-economical aspect, we think that this is a good thing because this will help a lot of countries that they are having a lot of problems in the aspect of having a lot of big old persons, like for example Japan. They're a country that they have a lot of people that is not enough to continue working, so this can help to make more young people that can benefit the workforce of the work production of the country and make a better structure of their economics and their works problems.
Now, about the social aspect, I would like to start saying that, the point of view of the morality, there is no such a thing like bad or good about this topic, because what we call moral changes through the time, and the more a practice is accepted, the more will be normalized, and in the next 20 or 30 years it will be not a bad thing or not like a taboo. If everyone or most of the people is doing that, everyone will accept it. Now, it is also important to mention that this can help to people who have hereditary diseases like Alzheimer. So if you do this process, you can change your genome and try to avoid these diseases. So for the people, it will be a good option.
Well, of course, there's the ethical aspect of this dilemma. Many argue that growing babies in a laboratory isn't ethical at all. However, the same was said about IVFs that started around 30 years ago. They said that it wasn't natural, it shouldn't be done, and nowadays it's a pretty common thing to do, and it has allowed people to have an opportunity to have babies that before wasn't possible. And I believe it's ethical since, if, as I previously said, we have IVF and also implantation genetic testing, which basically tests these babies done via in vitro for abnormalities in their chromosomes. So if we have the ability to know if a baby is going to come out good or bad, the ethical thing would be to ensure that the best possible outcome is done for this human being that is growing. Moreover, there's also the equality aspect of this, since we all know that mothers needed to, before this technology is invented, mothers need to carry the baby for 9 months. And sometimes parents in the relationship all need to work to survive. They need the income of 2 jobs. So if a mother in her pregnancy doesn't or can't work anymore due to the fact that she's really further in her pregnancy, the equality thing would be that if she could raise her son in a laboratory, so they both have the chance to keep on working.
Thank you, and now we'll listen to the counter argument.
Okay, so the first factor that we can look at is the social aspect, which can go back to the socioeconomic side. but the availability and affordability of this kind of procedure could lead to social inequalities. If these technologies are can be very expensive and not universally accessible, so it could create a divide between those who can afford such kind of procedures and those who can't. The widespread adoption of these lab-created children may face resistance due to the existing social norms and values, and it could lead to some sort of stigma, as well as the impact of family dynamics could arise as well as other factors like sense of belonging and identity.
In the socioeconomic aspect, you all said that thanks to this technology, more countries around the world will have the opportunity to have lab-created babies. But even though this technology doesn't exist yet, we know that it will be very expensive, and not all countries will have the resources to have the labs to create these babies. An example that we can see today is the in vitro fertilization, which is like a simple technique compared to this one, which consists in basically removing an egg from the ovaries, woman's ovaries, and fertilize it in a laboratory. That technique has a cost between $15,000 and $30,000, just one cycle, and the whole process can have many cycles. So now imagine how much it will cost growing a full baby in a laboratory, in an artificial room. That will be almost inaccessible for most of the people. Just a few will have the luxury to have this method.
Okay, also laboratory created children who enhance family planning and prevent hereditary diseases. And the alternative means such as genetic counseling or responsible family planning are preferable, because alternative methods like genetic counseling and responsible family planning have already demonstrated their effectiveness and addressing these concerns. Genetic counseling has successfully helped families identify and mitigate hereditary disease risk for years and promoting healthier family planning. This laboratory creation of children is not the solution to family planning challenges. Even the existence of alternative effective approaches resorting to laboratory created children is unnecessary and may introduce ethical and socio-economical complications.
Okay. I would like to ask the counter-argument question. I've heard you guys mention in vitro and all those other things. I would like to know your opinion, because you say that it's unethical and everything. I'd like to know your opinion on the current state of the world using CRISPR-Cas, which is a machine that genetically modifies a baby's genes before being born, in which they're currently testing, taking away diseases such as Down syndrome and other stuff like that. And what your opinion is that how this could impact the future of laboratory babies.
Okay, so it still questions the moral implication of designing certain traits in a child, and it could cause potential unintended consequences. We still think that manipulating genetics can bring the sense of belonging to children. It could I don't know, it could maybe damage the sense of identity also.
I believe that if it is like an improvement, it may be okay, but at the end, it's far from creating a human from zero. I think that it's like
like a surgery. If you have a problem, you can intervene and help the person and make changes in him. In this case, that person isn't born yet, and you can improve. I don't think that's wrong. Again, back to the topic, we're talking about creating a person from zero, and I think that's completely different.
I would like to address really fast what Alejandro and Alera said about the money issue. Yeah, of course, this technology, when it comes out first, is going to be very expensive. A few people will be able to afford it. However, it's the same with IVF. When it first came out about 3 years ago, it was very expensive. Not many people could afford it. And nowadays, the cost has significantly go down. Even there's health insurances that cover part of the cost. So it's like every new technology. Of course, at the beginning it's going to be very expensive, but with time it's going to decrease the cost with better manufacturing techniques, and all that implies this to be realized. And also, you mentioned that yes, you can change certain traits of the baby, and it might not be ethical since he didn't get a choice in that. And of course, there could be regulations implemented to avoid such things from happening. As we are saying, it's a technology that still is a long way from coming, and a lot of testing is going to need to be done first before it even comes to light, to ensure that there's not any genetic consequences unintended, and so on and so on. It still needs a lot of development and research.
Yeah, I would like to add that this topic is in 20 or 30 years. So we expect that it will be affordable for everyone. And you said something like it will be like differences between the babies. And Statista Mexico says that Mexico is one of the 5 most racist countries in the world. So it is important that already exists. And what we're trying is not to make a baby better than other, but trying to make every baby healthier.
Okay, I would like to address that and ask you guys a question. So there's already technology in which people like in China and some other countries are genetically manipulating babies, and they're already trying to do this by changing their eye color, changing the way they're gonna look. How are you gonna address the fact that these babies are being treated like handbags and accessories other than actual human beings, and that the parents are supposedly genetically manipulating them to look a certain way instead of for genetic betterment of the society?
Well, yeah, as we said, there could be like regulations to avoid just like the beauty aspects, but we think it will be focused on the issues.
And of course, this technology is still being developed. Of course, there's a question of people doing their own research, not being ethical enough. And this is why this problem should be addressed by governments and those in power, to make sure that the certain topics need to be discussed, to implement certain laws and rules that need to be followed, to ensure that in 30, 40 years, this is all being done properly and correctly.
I would like to go to the affordability factor again. According to Forbes, the IVF cycle, the one in vitro, right now it ranges from $50,000 to $30,000. That's still very expensive. Now imagine having a full-on procedure where you create a human being. The amount of money that would be, even if it's in 20, 30 years, it's still a very expensive procedure to make. And also the norms behind it. To this day, adoption, surrogates, and this kind of procedure, the IVF, is still very surrounded by these stigmas. So it's still so for this to be normalized that soon, I don't see it possible.
Also, raising a child demands a lot of resources. Parents, before having a baby, have to ahorrar a lot of money, save up a lot of money, and case, they are investing billions based on the continuation of this technology just for the babies to born. So what comes after? They almost have nothing. Like I said before, just a few people will have the luxury to access this technology, and I don't think it will go on fast. The time where it will be accessible.
Well, in a counter to this argument that you are saying that it's very expensive, we will like you to see it like an investment. And we think that in 20 and 30 years, the governments of these countries that are like trying to make this happen will like see it as investment and will help the people that can afford it to like achieve to make this. We also think that a lot of countries are suffering with the healthcare systems, so this process will help them to reduce all the healthcare that people are traveling right now, so they will like expend less in all their like hospitals and all the diseases that people are having right now, and they can invest this money, I don't know, in another sectors of the country like education or infrastructure or different things. So this in a long term of years, it will help in economics and all the money that they can save in the long term. So yeah, right now it will be like very expensive, as you said, and how Ignacio said, like right now it will be a lot of money expend, but in a long term it will like give more gains to the people and their health.
But you talk a lot about governments being involved in countries, but a lot of countries will not be able to afford this kind of technology. At least at the beginning. For example, there's the Vinci surgical system, which is a robotic surgical system that allows to perform minimally invasive surgeries. And this kind of technology is only available in very well-established medical institutions. So for countries to start, for governments to start implementing this, it would be very hard.
Yeah, so like for example, in everything, as a start, a lot of, well, just a little bit of countries can afford it. Like for example, United States, China, and all that countries that are very developed. But with the pass of the time, a little of countries like, I don't know, Mexico or countries that are like developed, they can like start getting a lot of technologies out of this, and with the pass of the time will not be at the same level of technology to make this process that is very difficult, but they will like have the basics to like develop it in the basic mode.
Also, as a counter argument, I would like to say again how sensible this is, because you said that I should see this as an investment. And here we come again to this ethical aspect, where we are seeing almost this as a business, creating people, and how much money it will generate, and how it can help society. And again, we are talking about humans, and I don't think that's a good direction to go. We shouldn't see this as how much profit I will take out of this. So I have that comment to say.
Okay, I would like to direct a question to you guys, specifically Mauricio. You guys are out of talking time. So, Mauricio, I'm going to dedicate a question to each of you. Now, I want to ask you, do you think regulatory framework can be a solution that will address the logical concerns associated with the laboratory-grown infants?
Could you repeat the question?
Yes, do you think that adding a regulatory framework instead of strict rules and conduct, such as your opponents have stated a couple of times, do you think that could be a viable solution for any framework concerns or regulatory concerns or ethical concerns that there could be with these babies grown in laboratories?
I don't think that still is ethical correct, but I just I just think that maybe it's still a luxury. It's not like I'm investing in. Yeah, I know that it can is your children now, but like it's his decision, right? It's not yours. You just need to, I don't know, pay for healthcare, pay for his or her education. I think that is not like an investment. Like, what is the positive thing about like regulate, like customize your child?
Well, as every technology that shows us, there will be regulations. And since the last century, it is known that every 10 years, technology improves 1,000 times. So the government must have a place to regulate this technology. And I think it is possible to standardize the process and put those things to not to do, or just having just for the people who have a good reason to do this process, that has the possibility to do it. So I think the regulations can be a good option, and I think it's possible to have the process.
Okay. We're gonna do one last question for you, and you can answer this question as well with your counter argument, and then we'll finish it up. Okay, so other than what you've already mentioned, do you think that we can ensure the safety and well-being of these artificially conceived babies throughout the entire process?
Well, obviously, there will be a lot of experiments before it is accessible to the public. And if clonation is possible to animals, I think the whole process could be possible to humans too.
Well, I think that it will be there will be risk, like in a surgery, there's always a risk, and I think like it's not. So you say,
It's worth it.
it's not worth it. Risking your customized child to lives. Maybe some deformation or something like that. Like the risk is not worth it for all the money, for all the I don't know, the waiting time, for all the ethical repercussions, yes. Yeah, it's a lot of risk for your baby.
Yeah, but what happens to the people who wants to take the risk?
That to take the risk is for like a death live situation, no? It's not like bringing life to just bring the life because the baby it still not exist, and it will be like a medical repercussions of like the same as like abortion, there's pros, there's cons, and like that.
Okay. Well, I would like to thank all of our debaters and your contributions to this discussion. And as we conclude, we can carry on what we have learned in this discussion, and we can use it to consider for our future, and not only the hypothetical one like I mentioned, but the very probable future of our society and what that may bring as we consider how to move along with this. Thank you all very much, and have a very nice night.